Until recently, Canada exempted e-cigarettes from many of the restrictions applied to combustible tobacco, intending to support adult smoking cessation. However, rising rates of youth experimentation have prompted Health Canada and the Department of Finance to restrict e-cigarettes, with e-liquid excise tax planned for October 22 and a proposed ban on flavours in process, as well as a nicotine cap on e-liquids implemented in July of 2021. Several Canadian provinces have adopted additional restrictions in recent years. While reducing vaping by young never smokers is desirable, reductions in vaping by current and former smokers would likely attenuate smoking cessation. Additional unintended consequences, including supply-side responses, changes in product characteristics, and demand-side adaptations, including modified vaping frequency, changes in vaping methods, and perhaps increased demand for illicit products, all carry potentially significant implications for public health, which should be considered by policy analysts. A trends analysis of time series Nielsen sales data was used to explore consumers' initial responses to restrictions. The data was collected from gas and convenience, G&C stores, from across Canada between 2019 and 2021. Online sales and those from vape stores were excluded. The data are disaggregated by product category, brand, province, flavor profile, and nicotine content. A welfare analysis is presented to describe the cost of the nicotine limit borne by the consumer and a discussion of how supply and demand side adaptations may offset some of the intended effects of the nicotine limit is presented. The federal limit appears to have halted the former growth trend in the G&C e-cigarette market. Substitutions to limit compliant products indicates robust compliance. However, the limit and provincial analogues have made e-cigarettes more expensive on a dollar per unit of nicotine basis. The annual cost to the adult consumer of the federal nicotine limit is estimated to be approximately 200 million Canadian dollars. Recent restrictions appear to have exacerbated market concentration. By late 2021, Juul and Vuse accounted for 99% of national G&C sales. Vuse has fared better than Juul, likely due to the continuation of flavored e-cigarettes where allowed, and the perception that limit-compliant Vuse products offers a more satisfying experience for nicotine-dependent consumers. The effect of the federal restriction was significantly muted in locations such as British Columbia, Nova Scotia, and Ontario, where provincial restrictions preceded the national limit. Evidence for increased sales in some limit-compliant categories suggests that some e-cigarette users are consuming greater volumes of e-liquid in response to the limit. The public health implications of changes in volume consumption of e-liquid should be explored further. The cost of vaping using closed pod systems has increased more than for refillable pod or open modular or tank systems. And this differential should be expected to shift demand to online and vape stores which sell those products. A planned follow-up study will investigate this possibility further. A reduction in demand for G&C e-cigarettes might also indicate changes in vaping prevalence and frequency and/or switching to illicit sources of e-liquids. Within the G&C market, at least, consumers do not appear to be switching to combustibles or heated tobacco products, though again, future studies are needed to explore these possibilities more fully and determine whether current smokers substituted towards e-cigarettes less frequently post-limit. Analysis of future Canadian tobacco and nicotine surveys should support such investigations. The federal nicotine limit and provincial restrictions have had a major impact on the G&C market for e-cigarettes, suppressing the former growth trend. However, declining demand for e-cigarettes is not necessarily indicative of a public health victory. While reduced vaping by young never smokers is desirable, reductions in e-cigarette assisted smoking cessation, increased relapse among former smokers, and potential health implications resulting from changing patterns of e-cigarette consumption could all subvert the intended benefits of the restrictions. These possibilities warrant thorough investigation. Determining the impact of the e-cigarette restriction on illegal or grey market sales is more challenging given the absence of direct data on illicit sales. But Canada's history of illicit trade in combustible tobacco suggests that growth in unregulated e-vapor products should be taken seriously. As demonstrated by the Avali episodes, illicit products carry harms that can be mitigated via appropriate regulations. Many of these considerations have not been adequately addressed in Health Canada's cost-benefit analysis.